Eye protection is required equipment for field hockey, although just like mouthpieces, athletes often do not put all the protective gear on until practice becomes official. As the sports PT comes out to the field, he has gloves on and asks if she is okay and begins the assessment. She has a laceration, so he immediately puts some gauze there for her to hold and stop the bleeding. The decision on how to move an athlete off the venue is different for each scenario. Is the athlete going into shock? Is it a lower limb injury? Are they in a lot of pain? Is it safe? Many times, athletes will insist on leaving the venue under their own power. Respect that when possible, but do not jeopardize or create further injury. The sports PT begins the assessment with sample questions and by observing her eye and head movements while she holds the gauze to her face. He performs additional evaluation to observe for any effects to the eye or the cervical spine itself. In this case, because of the location of the wound and the concern over good approximation, steri strips are being applied to her wound. Using a spray saline to clean the wound before placing a dressing or bandage is important. The provider continues with a more in-depth evaluation, assessing cranial nerves. The goals of wound management are simple: to avoid wound infection, assist in hemostasis, and to provide an aesthetically pleasing scar. Sutures are appropriate when the depth of the wound would lead to excessive scarring, and if the wound edges are not properly opposed. There is no set determination on the size of the wound. However, sutures are indicated whenever the laceration extends through the dermis. We strongly encourage parents and athletes to be examined, and if suturing is required, to engage the evaluation and treatment by a member of the plastic surgeon team, especially in the area where the scar will be visible or the athlete may feel sensitive about the result.